Hello, this is Dr. Leeds, and this is an unboxing of some items that came in from Thrive Pharmacy in Jacksonville, a compounding pharmacy. And let's see what we have here. These square things, which you can see they have a cross in the middle, that is actually a score line, which means that you can break these into 4 equal pieces. These contain medication. In this case, the medication is caffeine, which is not a prescription medication. So you can actually order these from Thrive without a prescription from a doctor. These Caffeine Melts. So you put these under your tongue and they dissolve. Actually, this one it says in the side of your mouth, or you could, I guess, put them under your tongue. Typically, these kind of medications are put under the tongue to dissolve, and the medication is absorbed there. But as you know, caffeine does work. You can drink caffeine in coffee, so it doesn't really matter if you swallow the thing or chew it up and swallow it, or if you put it under your tongue. But being a troche, a sublingual troche, that's what they call it, or a troche, typically they are used under the tongue. If they contain medication such as buprenorphine, which is used for the treatment of opioid addiction, will only work sublingually. It does not work if you chew them up and swallow them. So it's a good habit to use these in that way. If you also take these for that purpose. Anyway, so these are the caffeine melts. You can see there's different colors. There's also different flavors available. This one is a medical sample. So this has actual prescription medication in it. So let's see what this is. You can see here there's different colors and maybe flavors. Normally you can, you'll probably get these all one color and all one flavor. You can actually specify the flavor. So these are, let's see if you can read it, tadalafil, sildenafil. So these are like Viagra type medications. And Thrive Pharmacy sells these cheaper than what you would pay buying the brand name medication. And when you put these under your tongue to dissolve, they'll work faster than the usual tablet. And they're flavored, so they're flavored how you want them flavored. Okay, and here's some paperwork. So Caffeine Melts. There's different strengths. Okay, so you can get the 60. Oh, what are these bites? Oh, bits. Okay, that must be what these little things were. I was wondering what these were. So I guess these are the caffeine bits with a little less caffeine in them. You see all these flavors. And for all the medications that they make with these troches, I believe you can pick pretty much any flavor, and I think they have like 40 or 60 flavors. It's a lot of flavors. So here's the price sheet. So you see he makes buprenorphine for which doctors can prescribe for the treatment of opioid addiction. And see if we can look at the next page here. Also the erectile dysfunction medications. Naltrexone, which is another excellent medication for the treatment of both opioid addiction and alcoholism. So naltrexone, in fact, at lower doses, what they call low-dose naltrexone, or LDN, can be used for the treatment of a variety of conditions. I believe also fibromyalgia-related pain. And it's something to look up. It's interesting. Low-dose naltrexone, which actually this is low-dose naltrexone. He doesn't call it here, but it is LDN. 2 milligram and 4 milligram would be in the range that is defined as LDN, low-dose naltrexone. Typically for alcoholism and opioid addiction, naltrexone may be in the range of 25 to 50 milligrams. See all these flavors here. This is a sample prescription. Here he mentions altrexone, which is a combination of disulfiram, which is antabuse, and naltrexone. and helps people. You see here, this is the first ever combination of lower dose disulfiram with naltrexone as a double therapy approach to abstinence for alcoholism. The third leading cause of preventable deaths in this country, 88,000 per year. Alcoholism is or alcohol overdose and alcohol-related illness is really a big killer. You can see that he calls them ODATs, or there's another one called an ODAT. I don't think that one's altrexone. Then he has one called an ODAT, a 1 day at a time supplement. You see he mentions here dignity and respect for the patient, which is very important. Anyway, let's go back to let's look at the colorful stuff in here again. Did we look at that one? Here. Addressing the opiate crisis for $3 or less a dose. So these things are affordable. So again, we had we also have these no active ingredient. So these are like placebos. These are for me to share with patients if they want to see what it's like, how they dissolve under the tongue, how fast they dissolve, how they taste, with a couple of flavor samples. Here, another placebo, orange cream, fruit punch. I've tried the watermelon, which is very, very good. So again, this one, that was a caffeine one, 120 milligrams. So that's the top strength, equal to 2 cups of coffee. So, and remember, you can divide these up in 4 equal pieces if you want each. So they taste great, they work. One of them is not going to be too harmful if you already drink a couple of cups of coffee every morning. And of course, you can choose to have less, and you can even order them in the little bits, or you can break them, or you can order the lower strength of 60 milligrams. And again, the erectile dysfunction medications, they taste good, they absorb quickly under the tongue or in the side of the mouth. And so of course I don't have them here because Thrive is not going to send me samples of a controlled medication, but you can get the buprenorphine Troches or Troches, which are a alternative to Suboxone film and Zubsolv, Subutex. All those kind of things are very expensive typically for the brand name, and some of them don't dissolve as fast as others. Some of them don't taste great. So here they dissolve quickly. You get to pick your flavor. And another really big advantage is that the medication can be measured to your needs. For example, if your doctor is tapering you down gradually on buprenorphine, say that you start at 8 milligrams, the next month he can take you to 7, 6, 5, 4, 3, 2, 1. You can't do that with the brand name medications unless you start doing complicated combinations of the lower strength. I mean, imagine you want 6 milligrams of Suboxone. You have to take three of the 2 milligrams, which gets complicated and confusing and sometimes even very expensive. So, here, these are made to order for each patient individually, flavor, strength, and, the tapering is a big deal. I mean, so apparently he can make these as low as, for the buprenorphine ones, as low as 0.25 milligrams per troche. And remember, look at the back again. Each one has a little harder to see on this one. They have that cross where you can divide them into 4 pieces. So imagine if you've tapered down to not just 1 milligram, not a half, but you've tapered all the way down to 1/4 of a milligram, and you can take that 1/4 milligram troche and divide it into 4 pieces. Now you have 1/4 of a quarter. So you can taper down to very, very low amounts of buprenorphine, and which you can't really do with, at least not easily, but you really can't do accurately with the brand name products. And so people end up dropping off. They end up quitting buprenorphine at 2 milligrams or 1 milligram or even 1/2 milligram, which can be very difficult. The best thing is to get that dose as low as possible before you stop taking it. And And, this is one way to do it. So I hope that this video has been helpful, and I appreciate you watching. Thank you.